Excellent. Excellent. Thank you so much, Samantha, for inviting me here today to chat with the emerging leaders about tips for writing and reviewing conference session abstracts. The timing is great for this because, as many of you know, our Public Health in the Rockies conference is coming up this September, and the due date for the abstracts is coming up in April. In fact, it was just extended, so we have a little bit of extra time for that. So we're so happy to have you here today. Samantha did a great job of doing an introduction for me. But again, this is me and my co-founder of my little business called Advancing Dynamic Solutions. And we work at the intersection of public health, education, and healthcare to improve outcomes for communities. And we do a lot of conference planning, event planning with our business, as well as strategic planning, that type of thing. So I'm very happy to be here today. When I started my career, I had just gotten a degree in community health. And this was so exciting for me to be able to work to make healthier communities. I got my master's degree. I started in 2004, and way back then, there was no Colorado School of Public Health. So I decided to get a master's in education with a focus on adult education and training, which is why I'm really happy to be doing a training like this today. And it was the perfect marriage of looking at how to take community health and education and blend them together. So I was very lucky to do that kind of a degree as well. So I'm very happy to be here and sharing some information as well. So since we don't have a really large group today, and one of the things we really like to be able to do is provide some connections for folks, I'm going to introduce some folks, and if you could share your name and your pronouns if you'd like, that would be great. So, and just a little bit about yourself if you have a moment. So Samantha, I'm gonna actually have you start and share a little bit about just your name and your pronouns.
Yeah, absolutely. So my name is Samantha Bertoman. My pronouns are she, her, hers. And I guess a little bit about me, like I was saying, I've been with the CPHA for about like a year and a half or 2 years or so. And I'm currently a student at with the college. I can't even talk. The Colorado School of Public Health, studying community and behavioral health.
Excellent. Thank you so much. Haley, we'll have you go next.
Hi, everybody. My name is Haley Pucker. Pronouns are she, her, hers. I am a first-year MPH student at the Colorado School of Public Health at Colorado State University, and my concentration is animals, people, and the environment. I was really happy to hear, Amy, that, oh, my camera's on, sorry, I don't know if you want to see me or not, that you have an education background. I have undergraduate degrees in microbiology and community engagement and education. I'm also on the CPHA Emerging Leaders Committee this year, and I am our Health and Equity Delegate. And I'm very, very excited to be here and to learn from you today, Amy, because I think this is going to give me some really valuable skills going forward.
Awesome. And Colorado State University, woo! All right, excellent. Jenny, you want to go next?
Definitely. Can you guys hear me okay?
Yep, you're perfectly clear.
Okay, perfect. Awesome. Well, it's so great to see everybody here. My name is Jenny. I am a MPH student at the Colorado School of Public Health, and I actually did my undergrad at CSU, so go CSU. But yes, I'm doing my MPH right now at Colorado School of Public Health, and I am the communications delegate for the Emerging Leaders Committee with CPHA. And yeah, I'm really excited for today's workshop.
Awesome. Thanks for being here, Jenny. Woohoo, another RAM, very exciting. Kelsey, you want to go next?
Yeah, hi everyone. My name is Kelsey. My pronouns are she, her, hers. I am currently working at CDPHE's Office of Public Health Practice Planning and Local Partnerships as their public health planner. And I've also been with CPHA for a few years now, and I'm currently the Membership Associate Director. This was very timely with Public Health in the Rockies abstracts opening up. So I'm glad to be here today. Thanks, Amy.
Awesome. Thanks, Kelsey. Jenny says she forgot to add her pronouns, she, her, thank you. I also see somebody says, yay, UMD. So I'm going to call on you next, Lexi, says you must know the University of Minnesota Duluth.
Yes, actually I saw this and I stopped. You had me at UMD. I was like, I'm going So yes, I grew up in Duluth, but I also went to the University of Minnesota Duluth, where I actually have a degree in communication and then a minor in public health, education and promotion. And too far into my degree, I realized I wanted to switch degrees and go into public health, to which they told me it'd be 2 more years. And I said, I'll just go get my master's. So it's been a few years since I graduated, but I'm now out at the University of Colorado Anschutz in the School of Public Health, and I have a concentration in leadership in public health practice. And I also work at the university, so I work full time and I'm going to school. But yeah, you had me at UMD. I was very thrilled to see that because it's not all that common.
That's right. For those of you who are on the call who don't know, so Duluth is about 3 hours north of Minneapolis, St. Paul area. And then I grew up an hour north of there. And Lexi will know probably what the Iron Range is. Nobody else will, but it's a big area where they do iron.
Oh my gosh. It really makes me happy hearing that though, because you know how much you hear the Iron Range when you're growing up there, but then you move to Colorado and you never hear it anymore. So that makes my heart very happy. It's very nice to meet you, and I'm very excited to hear you talk.
Good. All right. Thanks. Thanks, Lexi. That's great. We have Lisa's phone. Lisa, I'll have you go next.
Oh, how funny. I'm listening from my car, so that's why it says Lisa's phone. But hello, my name is Lisa Peters. I'm the director of the Emerging Leaders this year, and then Samantha is going to take over for me. Shout out to her for planning this event, for coordinating everything. It's turning out incredible, and thank you so much for being here. My pronouns are she, her, hers. I am a reimbursement analyst at Centura Health. And then I also am an online student for my MPH through Hopkins. I've been a part of CPH for a few years now, but this is my first year on the board, and I'm very excited about all the opportunities that it has presented. So thanks everyone so much for being here.
Thanks, Lisa. We're so happy to have you participate on the phone when you can. And thank you so much for helping to organize this with Samantha. It's great. Olivia.
Hi, I'm Olivia Coe. I'm the finance delegate for Emerging Leaders Committee. I've been working in public health in San Miguel County for the past 2 years. While doing that, I got a bachelor's degree in business management as well. So just kind of really enjoying what public health is and understanding how we can affect public health in our community through more of the longer term processes. And I've always been a kind of a direct service provider. So it's exciting to understand how you can change the foundation of your community to make changes for the better for people's lives. And my pronouns are she, her, and hers.
Thank you, Olivia. I love when we have, I love the group that we have with people passionate about public health and making those broader systems changes. So thank you for being here. And lastly, Phyllis.
Hi, everyone. My name is Phyllis Barasa. My pronouns are she, her, hers. I retired from CDPHE a little over a year ago. I worked in the immunization program, and I also went to CSU. Amy, I think you and I were in the same master's program, just at different times. But yeah, my undergrad degree is in sociology, and my master's is in adult education. And I'm now that I'm retired, I've been really trying to focus more on CPHA because I really do want to stay connected to public health. And so it's been just a great opportunity. And so I'm now on the subcommittee for the public health in the Rockies. And this is just such a great training, really timely. So thank you.
Thanks, Phyllis. I hope at the end you still say it's great. So fingers crossed. All right. Thank you, everyone, for taking a moment to do introductions. I think it's really nice because one of the reasons we have CPHA in the state is to be able to connect with one another and learn from one another as well. So it's just nice to get to know a little bit of personal things about folks, all the people who are from all my alma maters and new friends. So thank you so much. And thank you for being so dedicated to the Colorado Public Health Association. As Samantha mentioned, I was on the board for 6 years and served as the president in 2013. And I was on the conference planning committee from 2005 to 2014 and used to manage the abstract process. So near and dear to my heart is all of this work. And so I'm happy to be stepping back in after an extended break to help to be on the conference planning team and talk today about abstracts. So one of the things I like to do when I'm doing trainings is to show people different types of tools that I like. So in the chat box, you'll see I put in a little link that says complete this Mentimeter. So if you want to click on that link, you'll see a question that says, have you ever submitted an abstract or proposal to present at a conference? And so you get to choose from 2 responses. So go ahead and select which fits for you. All right, excellent. It looks like everybody filled it out. We have 7 responses. So we have 6 nope and 1 yes. So this is the perfect place for you to be joining us. This is also a tool that I love called Mentimeter, where you can get feedback from folks really quickly and easily. If you haven't used Mentimeter before, it's a really cool one. So that's excellent. Just wanted to see kind of the experience that we had in this space as well today. So you're in the right spot today. All right, so the purpose of why we're here today is really for you all to obtain tips for submitting or reviewing abstracts for conferences. These tips are sort of generalized to any type of session that you're going to be submitting for, but particularly relevant for the 2022 Public Health in the Rockies Conference that's coming up September 27th through 29th. So again, all of you probably know this, but the purpose of abstracts is really to summarize the main points that you're going to present at a conference. And we're going to go over a few tips for that, but it really is, the important word there is summarize. And it's because it's meant to be short and brief and clear, which those 3 things are not easy to do all at one time. Again, submissions should be focused and clear in explaining your topic and your main points. So tip number 1 that we have, and this is a tip that I utilize when I'm submitting for a conference. We also write a lot of grants with our work. So federal grants, state grants, foundation grants. And one of the things that we always do that's really helpful is to scan the narrative document that we've gotten that tells you what you need to submit. So either an RFP or the abstract proposal documentation. And what I like to do, and I'm going to share this with you so you can use it if you'd like, I'll put this in the chat box, is this is an example of what I would do even if I was looking through a grant application or whatever. I'd sit down, read through the abstract proposal information fully, and then write down the different relevant pieces and parts to this. And this has been extremely helpful for me because it really makes sure that I organize all of my thinking and make sure that I get all of the main components submitted. Right now, I'm writing a drug-free communities grant in partnership with Jefferson County Communities That Care, and we did this process. And it was also helpful for us to then really make sure we're hitting all the key points. So you're welcome to use this for your specific conference submission. You can write notes to say, yes, I addressed, made sure I touched on the anti-racist efforts or health equity in there. You can type some notes, and of course, then you can click completed. Just go up and then make your own copy. So go up, make a copy, and make a copy for yourself. And you can use that for your conference submission. One of the things that I'm going to talk about is then looking at each of the specific components. And I'm going to make this just a little bit bigger so you can see it. So we're going to talk a little bit about those. So again, one of the things you're going to be looking at when you're submitting for your conference session, and we're going to talk about words in a little bit, but is really the importance of those words. Thinking about your title. Again, these types of things are the ideas that you want to make sure you're putting in. So ensure the title clearly states the topic and is free of jargon and acronyms. You're going to submit any other presenters that you're going to have for your session, their bios, there's a word limit on that, any CPHA committees that you're involved in, and then you're going to select your preferred session format. So CPHA does it in one way. Some different conferences do it in different ways, but what CPHA offers is either a program or research showcase, and they're either 30 minutes or 60 minutes. And we've been doing this kind of layout for years. The reason we wanted to break it up into 30 minutes or then an hour was really to provide more people the opportunity to showcase what they were doing. So if you're going to decide to do an oral presentation or submit for that, you really want to think about, do I need 30 minutes or do I need a full hour? If you do need the full hour, the abstract asks you why you would need that full hour as well, to make sure you're explaining that. The other options then are a 2-hour skill building session. And that's really for this type of training or event where you're digging deeper into something. You might not be presenting a specific research finding or project, but again, something that you could share with others. And then again, where we get a lot of folks who are submitting, who are students, are submitting poster sessions from what they might be researching as part of their programs as well. So lots of those submissions come in for posters that way too. So ensure your session is going to fit whatever format you select. We're going to talk about behavioral learning objectives. So you do have to submit objectives for your session. This is important because CPHA offers CHES credits, or Certified Health Education Specialist credits, for the sessions. And so they have to submit that these meet specific standards, and those learning objectives help with that. So we're going to go over those in just a little bit. And then what we broke out here for you is each of the sessions. So when you pick which one you're going to do, you could hide this other one. So if you're not going to do a skill building session, you can either just delete that or hide that. And so for each of the things you're going to be submitting, you're going to look at what's required. So again, one of the things that I will say is the most important piece of what we do whenever we write or review grants or these types of submissions is follow the instructions. And it sounds so basic and so simple, but that's why we always take the time to outline what the instructions are very clearly and make sure we're aligning with what those instructions say. So for each of these, whether you're submitting for an oral presentation, the 30-minute or 60-minute showcase, or a poster presentation, you're going to have to include your background or purpose, methods, results, and implications. Now, you might be submitting for something that's research that you did, or you might be talking about a program or practice that you implemented. Either way, you still want to use this type of format of what you're responding to. So when you fill out your specific abstract, you're going to want to write it to be 300 words, and then check to make sure that you've met these specific requirements within those 300 words. And then there's additional components that you want a brief description that they're going to include in the program. So that one could be a little bit more catchy to get people to want to come to your session in 3 to 5 sentences. And then the skill level content. So if it's beginner, intermediate, or advanced, which core services of public health it addresses. And this really helps the conference planning team to organize what sessions are going to go where based on which topic areas, and then any AV needs as well. So those are kind of the format of what you would utilize, and you can certainly use this abstract checklist to help you through your specific submission as well. And I definitely recommend using this type of thing anytime you're reading through a dense narrative of something you need to submit to organize your thinking around it. This type of format has been very, very helpful. All right. Cool. So the next thing we're going to talk about is focusing on words. So words are important when you submit a specific abstract. One of the reasons that words are so important is because you have limited space to be able to describe what you're trying to accomplish. So one of the things we're going to talk about with words is those behavioral learning objectives. So I'm going to have you do another Mentimeter. So if you go and click on the link in the chat box, you're going to see 3 different example learning objectives. And we want you to pick which example best fits for a learning objective for this type of conference. Which one's the best fit? So I'll give you just a moment to think about that. right, I think we have most people who've submitted now. So let's look at what we think. Oops, exit out over here, sorry. Now I can present. All right, so we've got 4 folks who think the first objective, 1 for the second and 1 for the third. And the nice thing, it's anonymous, so we don't know who said what, but we did have most people say the first one. So yes, that is correct, but I'm going to invite somebody to unmute and describe why they picked that first one as the correct one.
It's the most descriptive of the 3. I had a little hard time between the first and the second. The third one was a lot less descriptive, but when I think about SMART goals kind of and laying out like specific, measurable, attainable, those types of things, it says 2 strategies, building cross-sector partnerships. So it's really specific about what kind of partnerships and within where, like in the Complete Streets initiative.
Awesome. Thanks, Samantha. That's a great answer. One of the main things that sets this one apart from the other 2 is the very first word. Now, learning objectives, when you submit them, are sometimes different than SMART objectives. We've all talked about SMART objectives. That thing you might write in a grant might be a SMART goal, might be a SMART objective. And typically you start it and say, by May 2022, these things will happen this many times for this type of people, this type of group. With learning objectives, typically they're not specifically time bound in that way. They're really going to be able to describe what participants would walk away from the session and be able to do. So if I ran up to Samantha afterward and said, hey, Samantha, could you describe the 2 different strategies for cross-sector partnerships? And she would say, yes, I can describe it. So it's really that word describe that sets it apart a little bit because you want to be able to have something that shows though, that you could measure. So you want something you could list, describe, define. Words like learn or understand, you wouldn't be able to clearly be able to measure whether the person did that or not. So that's something for specifically SOPHE, the Society for Public Health Education. They review all the different objectives that we submit to ensure that we apply for credit in the appropriate way. So this specific type of thing is reviewed. The other thing I'll show you in the abstract checklist is where we talk about learning objectives. So you want to use a behavioral verb. SOPHE did include a little bit of an overview. They talk about SMART objectives up here, which you can certainly use the time-bound piece. And it's usually the time-bound is by the end of this session, participants will be able to use a behavioral learning or behavioral verb and write your objectives from there. The nice thing about this specific link that we have in that checklist and that's in the specific abstract proposal documentation is that it gives you some examples. This is based on, and Phyllis should probably know about this because she got her Master's of Education degree from CSU, is Bloom's taxonomy, which is a level of different types of method or levels of being able to implement a specific action. So you'll see, for example, on the side here, we're talking about applying. That's going to be something that you can probably do a little bit, in one specific way or another. So you're looking at different things you would do. So you could apply, you could calculate something, illustrate something, solve something. So those are all going to be in that kind of category there. So you're going to want to think about those different levels of what you want to be able to do and describe that in a learning objective. So they have some examples for you here. And again, these are usually, they have some entry level ones and some advanced ones that show the different levels of things. And then this chart here is really that is based on Bloom's taxonomy. And it goes up from the lower level of what, I'm going to make that a little bigger for you. The lower level here of being able to remember something versus understanding something. So right there. So remember, understand, apply, analyze, evaluate, create. So each of those become more and more advanced in regards to learning objectives. So oftentimes at a conference session, you're going to be more at the lower level because you're not going to have much time with folks. You're going to have 30 minutes probably with somebody. So you're going to have, think about that as well. All right. Any questions or comments on specific behavioral objectives? Anything that wasn't clear? Okay. So one of the other things when we're talking about our tip number 2, which is focus on words. So make sure you use those behavioral learning objectives when you write your objectives. Another thing is that you want to avoid filler words. So in the chat box, I'm going to invite you to type in what you think would be some filler words that might be used when people are writing a narrative of sorts. What would be considered a filler word? So put some examples in the chat box. Because of, succeed, okay. Any other thoughts? In order to, good, yeah. Too many objective or adjective. Yep, too many adjectives, yeah. Yeah, so filler words. So think about that. Like when you write additionally, for all intents and purposes, in order to, those types of things, actually, yes. So really think about when you're writing something that's only intended to be 300 words, think about short sentences, which sometimes can feel hard because I think we've oftentimes learned that academic writing has to be very long with lots of words in a sentence. But when people are reviewing, they're going to look to say, did the person describe what their methods were? So if you want to do that, you can say our methods were this. So avoid some of those fillers and keep those sentences nice and short and succinct. That's much, much more clear for folks. What's something else? Give me another example of something that people might not like when they're reviewing an abstract. What would maybe be hard for people to understand if you submitted an abstract? Give me an idea in the chat box. What's one other thing you might want to avoid when you're thinking about words? Olivia, you read my mind. Acronyms, jargon, yes. Perfect. So that's one of the things that it is hard sometimes to spell out those really long titles of things, but it is hard for reviewers if they're not intimately familiar with the work you're doing. It almost feels like they're having to decode a puzzle when they're writing that specific, looking through that and then scoring it based with that, those specific acronyms in there as well. So those are some things to think about. All right, so tip 1, you're going to use your checklist and get yourself organized. Tip 2, you're going to focus on your words, think about those behavioral learning objectives, use that guidance from Sophie to look at where you want to place those learning objectives, avoid that jargon, think about, not using those filler words. Those are all going to be helpful things for you. All right. Tip number 3 is going to be refine and review before you submit. So making sure you take that time to really read through what you're doing. Another thing that we oftentimes ask people to do when we're submitting either to present at a conference or for a grant submission is we ask a friend to review it as if they were a person who was asked to review that specifically. So that's another way you can use that checklist. So you could take this checklist and send this over to a friend and ask them to score you essentially, or give you feedback on these different types of things. And that has been really helpful to have somebody else just take a look at it and give you some objective feedback because they haven't been involved with it. They haven't written the words. They're able to see with a little bit more of an objective standpoint. So that's going to be your tip number 3. Review before you submit. All right, so we're going to give you an opportunity to get into some small groups, and I'm going to put these instructions into the chat box so you can take them into your small group with you. So in your small group, you can do a quick hello again. I know we all had the chance to introduce ourselves before, but these are the things you're going to discuss. Are you planning to submit an abstract? And if so, what's your topic and what type are you going to submit for? Showcase session, poster session. What questions do you have still? And then if time permits, any tips that you might have for each other when you've written something that's going to be reviewed and scored by someone else. So I'm going to send you over into some breakout sessions. What I'll also have here in the chat box, so you have your questions in the chat box, and then you also have another tool that I love called Padlet. So you'll see Padlet here. And what you are able to do then is if you do have questions, just click that plus sign and you can say, I have a question on objectives. And then type in your question if you'd like. And then if you have any other tips that you'd like to share with people, you can put them in there as well. So you can share with others if you'd like. So is there any clarification I can provide before I put you into some breakout rooms? All right, so I'm going to put you in your rooms. All right, and you'll have a little bit of time. Oops. All right, so you should be able to join. Lisa, do you want to go into a room or do you want to stay out here? Oh, we got her.
I can hop into.
If you would like to, you can jump into room 1.
I would love to.
Okay, perfect. Can you get in there and join your?
Yeah. Oh,
moment.
I feel like I haven't done anything worth talking about it for anyone yet. Like, what were you going to submit one on, Kelsey?
So right now I have 2 in the works. So one is a collaboration with CalFO on a few years ago, 2019, there was a big transformation needs assessment done with all of the local public health agencies. And then that was published shortly before COVID. And so a lot of the public health transformation work was kind of halted. And I don't know that there was really that much dissemination of the results from that work. And there's also just a lot of turnover in the last few years. And so there's a lot of new individuals at LPHAs that might not have been familiar with it. And so that's one hour-long session to share the results back and then just kind of discuss and build some momentum back up for some of the transformation work. And then the other idea that I had was a workshop, potentially as a partnership with the Office of Health Equity at CDPHE. One of our big goals is to really elevate the number of local public health improvement plans that have health equity as a priority. And most LPHAs are moving into their next planning cycle or have already started planning for their next cycle, which happens every 5 years. And so I've been getting a lot of questions from people about how to work health equity into their data collection, into their community engagement opportunities, into their communications, and things like that. And so I think we wanted to have a session where we can just kind of work through and brainstorm what that looks like for locals and kind of where they're at in their different planning processes. So I met with the Office of Health Equity earlier today. And so we're going to move forward with that one as well.
Oh, those both sound really awesome.
Yeah, thanks.
Nice.
I think the health equity one sounds incredible, Kelsey. That's really awesome. I think it's much needed. I think people would really go to a workshop like that.
Yeah, I'm really excited about it. Most of my role is providing technical assistance to local agencies as they do their assessment and their planning process. And I get a lot of questions on it. It comes up a lot when we have our networking calls. So I think it'll be a nice opportunity to actually have people in person too, to discuss it. Because it's hard to get everyone together since obviously the planners I work with are in all 4 corners of the state. And then hopefully we can do some kind of virtual follow-up or create some materials from that we can share with those who aren't able to actually be at Public Health in the Rockies.
Yeah, that's incredible. I know thanks. I have a question to add to the little Padlet thing. And
Mhm.
I don't know, I feel like this might be like a silly question, but I don't know, Haley and Jenny, you might be in the same space. Like as a student, what do you submit? I mean,
Yeah,
it's kind
that's
of like this, I haven't actually done anything, but would
yeah.
like love to be a part of something, which I know most of it is like research or you've implemented programs or something, but is there like some other option or something else? I don't know.
I think that's really hard too, because when right before you got here, I was like, who's submitting an abstract? And Jenny and I are both like, nah. Because I feel like I haven't done, even
Yeah.
though, I'm busy every single night and there's all this stuff going on. I feel like it's the same stuff probably that every person who's gone to, for an MPH has gone through. And I haven't done anything worth talking about yet.
Yeah, it also sounds like maybe some people use like capstone projects or different things like that to submit, which none of us are there yet. So I don't know. I feel like eventually we'll probably get there, but maybe we're just not quite there yet, unless you happen to be doing some sort of research or something.
Oh, that's funny, Jenny. I wish.
Exactly. Like no, not right now. not
I'm
not there yet.
Still trying to line up a practicum for this summer. So
Exactly.
like
Exactly. Yep.
So I think that's a really good question, Samantha. Like, what can we do? Or is there a way we can participate meaningfully this early on in our careers?
It does sound like because so public health in the Rockies, they have lots of like committees that help with reviewing abstracts. Is that right?
Yes.
Yeah. So I feel like that would be kind of a cool first place to start. I mean, I personally am not, this is kind of like the first that I'm really learning about abstracts and hearing more about it. So I think that will be a good kind of first opportunity to learn more about what people submit and what those might look like. And then kind of get some ideas from there.
I agree. Actually, I would really love to present what Lisa and I just presented for Sophie, but also again, and I'm like, Kelsey, maybe you have more ideas around this, but it's not a program that we've actually implemented. Like we just created it, and which was kind of what we were supposed to do. But essentially, it's not something that's actually been like implemented. So we have it's more like something that you'd be like applying for like grants to implement it.
Right. I don't know that much about what your project was, which I'm like so excited to hear about. But I guess like in developing an idea for a program, like did you guys do any background research, like a literature review or research on other programs? Like I feel like that could still, like that kind of preliminary research is still something that shows the need for a program or shows, this is an evidence-based practice that could work in the field, and maybe that does work for a poster session.
Yeah, absolutely. I mean, that's very true. Yeah, we did a ton of research. I mean, it had to be evidence-based, and we created a campaign for mental health, essentially within youth. So it was just kind of, but like I said, it's not something that's actually been implemented. But we did a ton of research, and we even have, like, I even wrote like how we would evaluate it type of thing, because like we went from like start to finish. So it was really cool. It was so much fun.
Right. I mean, I don't see why it's not worth trying, to submit something around, best practices in like for mental or behavioral health campaigns as a poster project.
Interesting. Yeah, that's a great idea.
Worth a try.
Yeah, it could be a good question to ask Amy and see like maybe what she's seen. Like, has she seen abstracts of more theoretical programs that people have created, or is it generally like programs that actually have been created so far? So yeah, I bet she would know more.
Yeah, I feel like seeing step by step what you guys worked on too is really helpful. At least would be helpful too for people who haven't had to do the program planning and things like that. I think it's a great learning opportunity for everybody.
I was totally listening to all of you. I was typing your amazing question and trying to put it into a question form. Oh my goodness. I always hate the countdown. It's like,
I know.
makes me laugh. Do we have any other questions that we want to add really quickly about this?
Yeah, I don't have any right now. I think those are both good ones though.
Okay. My like long-winded multiple questions. It's how I function.
No,
Oh my goodness. Okay, I'll see you all on the other one.
Sounds good.
Welcome back, everyone. Hopefully you had some nice conversation and connected with a few other folks during your breakout session. Thank you for typing in a few questions. We'll go ahead and review those. I'll share my screen. All right, so one of the questions was, as a student, what options are for submitting abstracts? Maybe submit for poster sessions, or how would we participate with this when we have not completed research or programs ourselves? So great question. And I think that also applies to that second question, which we'll jump into as well. The thing to think about when you're submitting for a conference is what you have something that's interesting or valuable to share in regards to public health with the broader field. So if you feel you have learned something or have something to share that you could show where you're demonstrating that you have some theoretical underpinning about why that exists and can explain it in the format for which the abstract's asking, you can certainly submit that. So sometimes when I've presented at a conference, might be presenting on something that we specifically implemented. For example, we created scoring rubrics when we were doing public health reaccreditation. And so we presented on those specific rubrics and how to use them. So that was a tool we created for the public health field and wanted to share with others. And so it wasn't a research type of submission we put in, but we talked about the methodology that we utilize to create these specific rubrics and how that would be beneficial to the field. So if it's something that you feel would be valuable to share with others, as an example, you could certainly submit for that as well. Your chances of getting submitted for or approved for a poster session are probably much greater for that type of thing as well. So if you're kind of wondering whether it's a fit or not, it doesn't hurt to at least try for that poster session to describe some of the things you've done. Typically, poster sessions really do fit best for sharing something that you might have done some research on, or at least done some type of background information collection on that you maybe had synthesized and would want to share with the broader field. All right, the second question was, have you seen abstracts that were strictly theoretical, or are they only programs that have been fully created and implemented? No, you can certainly submit for something that you may not have complete findings for yet, or that you're still in the process of working on, if you can explain the methodology for that. Specifically in the poster session piece, I'm going to scroll down to this here. So in the poster session piece, I think it did say specifically, results presented in the poster can be preliminary, incomplete, or such as in the process of data collection, and can include anticipated or speculated results. So that's a really good fit for a poster session if you're still in the process, because this time of year, you still might be in the midst of putting your proposal together or putting together your whatever research you're working on. And again, remember, by September, you might have all of those findings put together. So you can always indicate that your findings will be complete by the time the conference is going to be presented. All right, so those were some good questions. Were there any other questions that came up from your small group discussion? Or anything else you want to share, any ahas or tips?
I was going to ask maybe one more question just about students, and if you don't have anything to submit, maybe other ways that you can get involved or, you know, get experience writing, you know, abstracts or being a part of that. Is there anything like that?
Well, one of the things that I would recommend is actually the next thing we're going to talk about is being a reviewer for the conference. So I'm going to just skip over here to the Public Health in the Rockies page. So again, this is publichealthintherockies.org. If you go here and go to 2022 schedule, this is where you'll see the whole call for abstracts. So this is where I pulled that whole checklist from. It's just all this information in a checklist. The other thing that you're going to see here is the opportunity to have a call for abstract reviewers. So this is where you can submit, you can click here to sign up, and it will ask you about different types of expertise that you have. And then you'll be assigned abstracts to review. So that would be a great way to get involved and to actually be exposed and see, well, what do people actually submit? How do they write their objectives? How do they write their summary for what they want to submit for their session? So that's great. You don't have to have a ton of experience. The nice thing when we do conference reviews is that you always have at least 3 reviewers, so that you're always backed up by somebody else who, if you don't know all of the ins and outs of something, you're going to score it based on the experience you have and how you were able to read it. And oftentimes that's beneficial to have somebody who may not have a ton of background be a reviewer. So here's a few tips if you do want to be a reviewer. One is ensure you have time to review. These won't take all that long to review because they're only going to be a 300 to 500 word submission that you're going to score based on a rubric that they send you. So it should take you anywhere between an hour to 2 hours. Sometimes it takes a little longer though, if you really want to make sure that some of them, take time to really think about and analyze. So just make sure you have the time to review. The other thing when you sign up to be a reviewer, and this is it for this or in the future, if you ever sign up to review grant proposals or different things like that, if you have that opportunity, is really think about the bias that might be coming along with you and what you might be thinking about when you review. One of the things CPHA in their work to really be an anti-racist organization ensured that no photos would be submitted to reviewers so that there wouldn't be bias based on appearance, particularly for people who have been impacted by systems of oppression. We wouldn't want them to be impacted again by even implicit bias that we might have. So just acknowledge that we all have bias that we come in with and really think about that and think about CPHA's really anti-racist efforts to ensure that the systems that we put in place for these types of things are creating more equity. So that's our second tip. And the third tip is really analyze the submissions using the instructions. What I will say, both for either submitting an abstract or reviewing an abstract, the important thing is reading the instructions and really analyzing then what you're supposed to be either submitting or scoring, and really taking the time to do that and taking that role seriously as well. So that's one of the things you can do is sign up to be a reviewer, and that will give you some good experience and getting exposed to what different people are submitting and how scoring rubrics work. And it kind of gets you just a little bit behind the scenes as well. So that's great. Another thing you can do is you can sign who can take on a role during the conference. And so that's another opportunity for you to get involved as well. Anyone else have any suggestions of other ways that people who may not have, feel they have enough information to submit for to submit an abstract? Any other opportunities that people think are available? Nice. Samantha, when you say that info to put in the chat, which info would you like me to put in the chat?
I was just wondering if you had the abstract to sign up for the abstracts, and I can do that as well for you. I wanted to make sure too you knew that you weren't sharing your screen, so just in case. Okay. Okay, awesome. Thank you so much.
Perfect. All right, that's the call for abstracts, and then this is the call for reviewers. All right, perfect. So as I just mentioned, we have those 3 tips. Ensure you have time to review, acknowledge bias and support CPHA's anti-racist efforts when you're signing up to be a part of any CPHA's efforts, and then analyze the submissions using the instructions. Again, the most basic thing you can ever hear, follow the instructions. All right, do we have any other questions or clarification that people would like for this work? All right.
So even if we feel fully unqualified to be a reviewer, we could still be a reviewer.
Yeah, you can certainly sign up to be a reviewer. The nice thing again is that there are 3 people who will review them, so they'll average out that score. And it's good for people who may not know a lot about something. I've reviewed ones that aren't in my area of expertise, but it's nice for me to be like, well, they described it enough for me as a person who doesn't understand much about wastewater to understand. So yes, I think that you can certainly sign up, and you probably have a lot more experience and expertise than you're giving yourself credit for as well. Anything else?
There was another question in the chat, Amy, about the is the rubric available to view?
I haven't seen it yet, Phyllis. I know that you are also on the abstract team with me, I think. So I think once that's developed, or if it's been developed, that could be something that could be shared, but I haven't seen it yet. But typically the rubric's going to align specifically with the questions that have been asked in that. So it will say, like, did it fully describe the methodology that would be used? That type of thing. So it's definitely, the rubric should always align with what the specific things that are being asked for. And they've done a pretty good job with that with CPHA in the past. All right, so I do have some of these resources. So I will share a PDF of these slides with Samantha, and we can buzz those out to people. But we have the CPHA main page, the Emerging Leaders page. Thank you for sponsoring this wonderful event tonight. And then all of the links for the different ways to get involved with the abstracts, anti-racist resources, as well as that SOFI objective guidance as well. So those resources are available to you. All right. Samantha, I'm going to turn it over to you for next steps.
Yeah, thank you so much, Amy, for the presentation. I definitely learned a lot, so I really appreciate this personally. I also just want to mention that I myself, last year, it was my first time helping to review abstracts. And I don't believe I got in at the beginning of it, but it was at the very end, and I helped put some of the conference together in general. And they paired me up with somebody else who had been reviewing abstracts for like some 30 years or something. So at CPHA specifically, if you're looking to gain experience reviewing, they will absolutely help you and answer all of your questions. And I felt like it was a very great experience. And I know I personally am really looking forward to this year kind of being more a part of that and learning as you go. So I feel like CPHA, in my opinion, and I feel like I know Lisa and I have both talked about it, it's a very forgiving place to learn. So I definitely encourage you, if you're interested in learning how to write abstracts, like Amy was mentioning, it's really great to be able to review them, and you can get an idea of what people are actually submitting. Okay, awesome. And I'm sorry, I guess Lisa, I don't know if you help me to coordinate the door prizes if anyone was interested in those.
We will be sure to send an email to our winners. So we have a few more minutes to apply. It's only $1 for a free yoga session. You can invite as many people as you want, as well as a free membership. And you don't have to use that membership this year. You can use it next year. And then any of our free merch, including hoodies, t-shirts, sweatshirts, we have mugs and face masks, which